All right, interesting things I've noticed in the hospital, part 2. Providers and nurses ask the pharmacists a lot of questions. Like, that phone is going off like all day. It's like mostly like compatibility questions, like can we run these 2 drugs in the same line? But we'll sometimes get some like good questions. So a provider had a case of extravasation with potassium. Potassium is what we call a vesicant, meaning when it leaks out of the IV line into surrounding tissues, it can cause severe tissue damage and necrosis. So yeah, it can get pretty bad. This was the other day, and the provider called the pharmacy and was talking to one of our other pharmacists and was basically like, what do I do? And they were like, okay, well, you're going to want to put in an order for hyaluronidase. And the pharmacist told them how to put in that order. It's part of an order set, actually. Also mentioned that when you have like vasopressor extravasation, you want to use phentolamine. It's a non-selective alpha blocker. So for example, with like norepinephrine extravasation. Another interesting thing that I noticed is that there's something called pain consults. I didn't know this was a thing. I knew there were like consults for other medications like antibiotics and blood thinners. Consults are like pharmacy to dose kind of thing. So a provider will put in a task for the pharmacist, and then we will dose like certain like toxic antibiotics, or we will initiate certain blood thinners like warfarin. And we can also put in like orders for like labs like INR and APTT, stuff like that. We also have consults for TPNs, total parenteral nutrition. This is when you're getting your nutrition through an IV line. The pharmacists are the ones creating the TPNs. There's a lot that goes into that. So we have to calculate like weight, how many carbs and proteins and fats does this patient need. We have to look at how many electrolytes this patient needs, and then look at their labs and then adjust their electrolytes based off of their labs, or like their like renal function or any other issues that are going on. Lots of stuff to consider with TPNs. And then of course with like infection risks, with central line associated BSI or CLABSI. And then also sometimes you might want to run it like cyclic versus over a 24-hour window, rates, stuff like that. They also have other little consults for like CRRT or continuous renal replacement therapy. Bunch of other little random stuff. But pain consults, I had no idea were a thing. This is when a patient is basically in pain and the provider cannot manage it. So they'll put in like a consult with pharmacy to like manage the patient's pain. So with these, we have to like consider a lot. For example, what are possible sources of pain? What's the goal for this patient's pain? Are there any non-pharmacologic interventions we can make? Is this acute pain? Is this chronic pain? Is this acute on chronic pain? Is there a multimodal pain approach going on here? Is there a concomitant substance use disorder? And then we have to consider things like IV to oral transition, switching between opioids and incomplete cross tolerance, and then managing side effects between opioids. I could make a pain consult video later down the line when I have time.